Are you ready to shatter ceilings, to redefine what's possible in your life and business? Then welcome to the Beyond Woman podcast, where we dive deep into the heart of empowerment, the art of crafting a lifestyle business that truly serves you, and the tools to unlock your most authentic, powerful self. I'm your host, Jacqueline Walker Johnson, and here we celebrate the women who are rewriting the rules, the visionaries carving their own paths, and the experts who are sharing their hard-won wisdom to guide us all. Join us for intimate conversations with women who are not just talking the talk, but walking the walk. Women who have the expertise and the sheer grit to empower you to step into your limitless potential. Get ready to be inspired, challenged, and transformed. This is the Beyond Woman podcast. Let's begin. Today's conversation is hosted by Michaela Brown, and she's joined by Dr. Terri-Ann Thompson, a senior research scientist at Ibis Reproductive Health with over 15 years of experience in public health. As part of her work, she partners with community-based organizations, healthcare providers, advocates, and other stakeholders to ensure research questions align well with people's priorities, amplify the experience of disparate populations, and examine how existing policies and services could better serve people's needs. Prior to joining IBIS, Dr. Thompson worked for Yale University School of Medicine, directing the Coordinating Center for the Eastern Caribbean Health Outcomes Research Network. Dr. Thompson has dedicated her career to studying how reproductive health policies and care models affect women's well-being, while ensuring the voices of diverse communities are truly heard. In this conversation, she helps us navigate the silent struggles many women face, from reproductive health conditions that often go undiagnosed to breaking the stigma around menstruation, preparing for menopause, and protecting our mental and emotional well-being. Get ready for an honest, empowering discussion that sheds light on how we can nurture women's health and wellness at every stage of life.
So today's topic is none other than Beyond the Bloom, and we'll be focusing on the nurturing of women's health and wellness. So now, before we get into this conversation, I will allow our guest, Dr. Thompson, to introduce herself and give us a little bit about herself.
All right. Well, good evening, good morning, good afternoon, whenever you're checking out the series.
Yes.
I say good day to you. My name is Dr. Terri-Ann Thompson, pronoun she, her, and I am a Caribbean woman. I am originally from Portland, Jamaica, so a country woman, actually. But by training, I am a public health researcher with a emphasis on reproductive and sexual health. I've been in the public health field for over 15 years and have done work on a range of different topics, family planning, Afro-Jamaican woman identity formation. I've also done some work on maternal health and adolescent health. You name it, I have done it.
All right. Thank you so much for that, Dr. Thompson. My first question for you is, what are some of the most common reproductive health conditions affecting women today? And why do you think so many are undiagnosed for years?
There are several common reproductive health conditions affecting women today. There are sexually transmitted infections such as chlamydia and gonorrhea. That's a continuing concern. It's not new. There are gynecological cancers such as cervical cancer. There are uterine fibroids. There is endometriosis. There's polycystic ovary syndrome. There's HIV, and there's infertility. So there is no shortage of reproductive health concerns that women face today. And one of the reasons I think that some of them go undiagnosed and untreated for many, many years is first, because some of the symptoms are easy to miss or they're missing altogether. So many women would consider, as an example, pain during sex to be a normal thing, but not realizing that pain during sex actually could be a symptom of uterine fibroids. Many people with chlamydia have no symptoms whatsoever, so they wouldn't even think to get tested. And in other cases, people go undiagnosed for years because they are hesitant to actually get tested. Then that might be due to stigma. It might be due to internal shame, or it might be due to the concerns that actually come with the costs that might accompany treatment, right? Everybody knows that there is a cost to healthcare, and it is sometimes the barrier that causes a lot of people to not actually utilize much needed healthcare services. The last thing I will say is that a significant proportion of women, especially Caribbean women, are actually without a gynecologist. And this might be due to a shortage of gynecologists in the region. It might be due to the fact that there's a concentration of gynecologists in the urban areas rather than rural areas. And it might be due to the fact that a specialist is sometimes outside of their financial means. So when you are not in constant or consistent, when you do not have consistent access to a gynecologist, it means many times things like your chlamydia, like your uterine fibroids, like menopause, right, can go undiagnosed, untreated for many years.
Okay, thank you so much for that, Doc. So I hear that you mentioned that a lot of times it's also or financial reach as women. And that is true because it's rather on the pricey side when it comes to visiting a gynecologist.
Absolutely.
So normally, rather than going to a specialist, we find that women are just going to a general practitioner, physician, and whatever he or she says, that's what they will take as a diagnosis, if not recommended to a gynecologist. And sometimes even when recommended, they decide not to go. Not only because it's out of their price range, but in Jamaica, to be exact, I'm not sure about other countries, but majority of what we would call top-notch or the good gynecologists are located in the urban area. So
Absolutely.
Not only would that factor in transportation, it would also factor in the price that you'd pay for the visit. And
absolutely, and all of that is out of pocket, right? So it's not insurance. Speaking from the Jamaican perspective, right? Specialists are different costs. So you are absolutely right. If I think about what the journey would be for a Portlander to first have to leave Portland, if you don't have your private vehicle, taking a bus or a taxi to go into Kingston to get to see a specialist, that is not a small cost. And for some, it is insurmountable. So the logistics, in addition to the cost of the service itself, can really be a hardship. And as I mentioned before, there is no shade that we're throwing on general practitioners. They are often the person that's standing between an individual and good health, right? Like they're the gateway through which people are actually receiving healthcare and getting good health outcomes. But there are things that are beyond their purview and their scope, and that's why you have specialists for a reason. And so there are things that they might be able to see and treat, and there are other things that you just need to go to a specialist to be able to diagnose and treat. So I really think that is a big concern, and getting people more access to that would be really helpful in the Caribbean. We also, part of the reason why we're having shortage too is because of brain drain. It's because of other factors related to, appropriate payment of folks, particularly for those in the public health sector. So there are lots of ways in which I think we have to make systematic changes to afford and to allow for more consistent access to specialists for folks. But that's just part of the story, right? As I mentioned before, there's so many other reasons why a reproductive health concern might go undiagnosed and untreated.
Yes, definitely. So that leads me to my second question for you tonight, which will enable us to speak on, let's say it's somewhat this is rather a touchy question. So our second question for tonight is, how can we break the stigma around menstruation so women and girls feel comfortable discussing period pain, irregular cycles, and menstrual health openly?
First of all, I will say this, as much as I know it to be true that there is still stigma around it. There is a part of me as a woman that, the question that comes to mind is why? Why, right? Like, why are we still here? Menses are a natural part of a woman's biology. However, conversations about menstruation have remained siloed for years, right? And what do I mean by siloed? It means they're isolated conversations, whether those are conversations between mothers and daughters or teachers and female students only. These are siloed conversations. And what siloed conversations result in is insufficient, inaccurate, and oftentimes stereotypical information being passed along. So what does this look like on a day-to-day basis? It looks like male partners, male colleagues, and bosses not understanding menstruation, not understanding the symptoms and the presentations, and quite frankly, saying very ridiculous things sometimes to the female counterparts, right?
Yes.
It also looks like other women not understanding what menstruation is, and that the fact that it presents differently for each woman, right? So you have menstrual shaming that's happening between women, which is not okay at all. And it can also look like some women not taking enough action to protect themselves from pregnancy because they don't quite understand how to navigate an irregular cycle. So, that's part of what is happening, I think, in the atmos. Now, how we break the cycle or level set, as I would like to say, it's, we really need to start with comprehensive sex education within the schools. We need to afford accurate information about menstruation to both male and females. But it would also be good to provide parenting education. Information, especially as it relates to sexual and reproductive health care, it needs to be shared multiple times and in multiple ways. It's not a one and done situation, okay? When you tell somebody at 11 what menses is, it is in one ear, out the other ear if they are not currently menstruating or not close to that, right? So it needs to be shared multiple times in multiple ways. And even if children are hearing the information at school, knowing that they're able to get some of that same information at home, that they can ask a parent a question, will actually boost their confidence and boost their comfort in discussing this subject area. The other thing I think we need to talk about more is just we need to be more open about talking about it within our peer groups, right? Like for some of us, menstruation is still sort of behind closed doors. It's a very private kind of thing, right? When the truth is, so many of us, I think, would benefit from hearing some of the similarities that we are experiencing across, right, the aisles. So even when I think about one of the ways that I admire, believe it or not, I admire always, right, the people who make the sanitary, the hygiene products, the sanitary napkins. Always when they came out with the different kinds of wings and different kinds of pads, talked about the fact that there are different days carry different flows.
Yes,
right?
and different women have different flows
and
as
different
well.
women have different flows and different kinds of patterns. And just that small thing of being able to say nationally, publicly, look here, everybody, every day the flow naga be the same. Everybody naga have the same kind of pattern of flow. And sometimes when you're asleep, things gush, right? Like the fact that always could come out and say there's gushing that happens, it really helped to normalize that for some women. And so I think the more ways in which we can have at multiple avenues, this information coming out and not being siloed, right? Like men love to say, it's not my problem. Well, if you have a partner and the partner is female, it's your problem, right? Because she might be having a really difficult time and you need to understand why. So I really think that's the way that we can break some of that, is to really level set by increasing both the knowledge about menstruation across the aisles, across women of different age groups, different genres, different generations, I should say. And then also by really normalizing it in through as many avenues as we can. And so I have to shout out always for taking a step to really normalize menstruation in that way.
Yes, definitely. I want to touch on something that you said about sex education in schools.
Yeah, sure.
This has always been something that I strongly believed in, that HFLE and guidance and counseling as subjects don't teach enough about sex education, and a course needs to be done specifically towards that for both women and men, and both counterparts should be able to understand each other and their
bodies. Absolutely. But first we also have to work on sex education itself too, right? Because the curriculum, some would argue, is basic.
It's too exposing.
Right? It's basic. It's not giving you nearly enough information that you should know. And part of why it's not giving you enough information, my dear, is because the people who are teaching it are not comfortable teaching a more detailed kind of information. And some of that is still tied to an archaic way of thinking, which is, if we talk about sex, then it pushes people to want to have sex. Yep. Newsflash. If people are exposed to sex in so many different ways, if they are quote unquote wanting to have sex, it's because part of that is naturally biology. There's a curiosity that happens around the time of puberty. How better to manage some of that curiosity than to arm people with the information that they need to make good choices, to make informed choices, and to be able to understand what is happening. Exactly. And what we do when we do not provide detailed information is we take away the opportunity for people to understand what is happening and therefore make an informed decision. So I really think we have to let go of some of that discomfort. We need to get guidance counselors and create curriculums that really give people the information that they want and arm them with the information that they need. And part of that will require us to get people who are comfortable discussing those topic areas.
Even up until this very day, in my not so old but old age, and I'm sure older women also have this, I would call it a phobia, but when using a public bathroom and it comes down to pulling a sanitary napkin, maybe I think a group of women also said this once at a conference, and through case studies and surveys, they also talked about sometimes it can be unnecessary load.
Yes,
and rather
man.
drawing attention to the
Of course.
And I think that that's something that we should not be so conscious of.
We
or
really
so
shouldn't.
embarrassed of. But
We
once
really
you pull the
shouldn't.
rapper and you hit, it's like everything goes silent at that exact moment. So the rapper is the lowest thing in the room.
Pulling the wrapper or taking it off of the panty seat,
Yes.
right? When the line when it comes off.
Everything
Both
goes
make noise. But you know, I will also say this, we should be grateful. They say always look to your blessings, because in this day and age, what I saw them have to wear before, which was
The
a full-on
nappies.
contraption, before I would never,
That's
ever
true.
want to have to manage that, right?
Mhm.
And you know, I will say this, so much about menstruation is it's not only triggering, it carries a lot of embarrassment, it carries a lot of things, right? Like, I mean, when you think about it, it's not only I think that you're managing when you're young, that oh God, all of a sudden I'm bleeding. But the fact that spotting can happen, not spotting, but staining, right? Because if you know what good, the pad can shift, right? And all of those things. Like, there's so much of that is something that many of us can relate to across. It's almost like a rite of passage in some ways. A pad shifting, a tampon, you know, you forgetting a tampon, you being conscious of something, like so much of it, you going to the beach on your period, right? Like, there's so much common ground. And I really think the more we can normalize and more that we can say, listen, that's part of the course. We don't have to make it a big thing. And we certainly shouldn't make it a big thing within our group, right? Like, across women, we really should be more accepting and more and allowed to be more normalized. There's nothing shameful about a natural part of our biology. It serves a function. It is a natural thing that we have to go through. We have to just increase the awareness, and I think really sort of normalize it as best as we can.
Definitely. I also think
But I hear you. And again, counting my blessings, we have come a far way. Just even in thinking about that bathroom and the fact that within stalls you now have places to put your used, sanitary napkins, your used tampons, things like that. We have come a far way. So I can only keep looking up, because better must be there, right? Like, better must be coming. And so I can only look up and hope for even more progress in that area. Already we're seeing some progress here in the United States, progress in terms of equality, right? So people calling to attention things like the fact that women have borne a greater financial burden than men for many years, right? We are spending far more money on products at every level than men are. And so there are people who are sort of advocating at this point for period products, meaning sanitary napkins, so on and so forth, to be tax-free. And even some are going further, right, to say that they should be a public benefit to us, because it's not like we are choosing, we are out here going, I will take period, I will not take period, right? Like, and because therefore you're bearing an additional cost.
If we had a choice based on everything that it comes with, both emotionally, mentally, physically, I think all, if not majority, all would choose not to go through
You have some lucky people out there, Michaela. You have some very lucky people who have no pain, no nothing, zero, right? It's like 3 days, boop, it gone. And I am grateful for those people to show me that there is a side, there's a part of the spectrum that is like that. But I think you're right. Many more of us are on the side, and there are a few of us who are on a really rough part of the spectrum, right?
Yeah.
debilitating pain, have to take sick days from work. My heart goes out to my sisters who have to manage that. But the more we can actually sort of call attention to the fact that this is an additional burden, and then you add the money on top of it, it's really not fair, right? It's really not fair.
Definitely.
So I applaud the efforts of folks who are advocating for that. And as I said, progress and better must come. We just have to keep pushing.
So to add to all of that now, we've spoken about what menstruation is like for the most part. Now, let's talk about the aftermath. So menopause is often treated like a silent transition. So how can women better prepare for it physically, emotionally, and mentally? I will tell you, Doc, I have seen it first. I used to think that, maybe they're overreacting, but I have seen it firsthand. I saw a video of a woman who looks like she was going through menopause and she had cut all of her hair off. And she was sitting outside and she was sweating. And you could see that her temperature was rather high because of this evaporation coming from her head. And she had no hair. She was completely bald. And you could see the evaporation. And I'm saying to myself, after so many years of all of that,
all of that being menstruation.
All of that being menstruation, it wasn't
and possibly
enough.
Also childbirth, right? Because if you're just adding up all of the things that we got you, so there's menstruation, there's pelvic exams, right? there is no childbirth, and then no menopause. Sure. So after all of that, you have to manage menopause. I hear you. Menopause. I'm glad to see that the notice that is coming. Or rather, let me rephrase. I am glad to see that menopause is getting more attention. Yeah. That said, menopause, we still have a far way to go in terms of the level of attention menopause should get. I will tell you, as a person who has been researching sexual and reproductive health issues for years, menopause, uterine fibroids, these are very understudied topics. It also doesn't help that these understudied topics are studies that are topics that are more prevalent in Black women, meaning across the diaspora as well as African American and African women, right? Like Black women, we see more fibroids, uterine fibroids, and in terms of menopause, our symptoms tend to be worse than our counterparts, right? So it really is very distressing when you hear that we really haven't haven't gotten all the knowledge that we should on this issue that is affecting so many of our sisters, so many of the sisters in our community. But here we are, and the hope is that, again, I'm being hopeful tonight that there will be progress and we will see, more that is being done, both to understand it as well as to address it. I already started on this earlier, but I'm going to say it again. Public awareness, public education is key here. I think first we need to increase people's awareness of what menopause is. Menopause is a natural biological process that occurs when the ovaries no longer produce eggs and release hormones such as estrogen and progesterone. We also need to make people aware of a few facts related to menopause, including people who are making the transition, right? So in the set, we need to make people aware. I mean, everybody needs to be aware of these facts, right? The first thing is that menopause has 3 phases. There's perimenopause, which occurs several years before menopause. In fact, some women enter perimenopause starting as early as their mid-30s. Then there's menopause, which is when a woman has not had a menstrual period for 12 consecutive months. 12 consecutive months. That means that if you don't have it for 4 months and then you have it for 1, you are not in menopause. The clock literally restarts the minute you have a period, right? So it has to be 12, 1 month after another, in a row before it can be declared menopause. And then the last phase is postmenopause, which is the period after menopause ends. Another fact that I think might actually broaden people's perspectives on menopause is that it presents differently for every woman, and the symptoms are wide and varied. So you talked about a symptom that is common and that most people see, in the movies. Many women have it, right, which is hot flashes. But others have things like extreme mood swings. There are people who are very cross, angry, and miserable, right, all of a sudden during menopause. There are
Yes.
people who are extremely fatigued. There is vaginal dryness that comes with menopause. There are people who have joint pains. I have a friend who all of a sudden she have tennis elbow can't work, and elbow no good no more, right? Once menopause starts. And then a number of other women experience weight gain, right? So it is many different symptoms and they can be very varied. So we need to keep that in mind. I think knowledge can really help to mentally prepare people, because this way, when the changes start to happen, they don't come as so much of a surprise, but rather they come as a signal. They are something that should say to you, hold on, I probably should have connect with my OB-GYN or connect with my PCP, which is your primary care physician, to ask them what is happening. I have gone from 120 to 160 almost overnight with no changes in my diet and exercise. What is happening? Or I am sweating through the sheets at night. Something is up. What is happening? Remember, doctors are kind of like researchers. They can only diagnose if you bring them the information. So you have to know your body. You have to collect all of the information about what is happening and bring it to them so that they can help you to understand, to identify, to detect, almost like a detective, to detect what could be happening.
Yes.
Physically, I think women can prepare by connecting with their OB-GYN. Hormone therapy is actually available and it is successful. If you start hormone therapy sooner than later, it can actually help with the transition. And nutritionists can also help, right? They can help during perimenopause and the menopause phase by helping you to understand some of the dietary changes that you could implement that could ease some of the symptoms that you're going through. And then you asked about emotionally. Yes. Real talk, I think it is good to have a support group or supportive people around you. That means you need to have others, whether it be other women, whether it be your partner, whether it be your church sister, them, whoever it is, your church family, whatever it is. You need a support group to be able to talk to about your symptoms or about your journey. Because sometimes trying to understand what is happening in silo by yourself can really be challenging. It can be frustrating because you're confused, you're not sure what is happening. And sometimes when you share it with somebody else, they can be the ones to say to you, oh, my girl, I started going through that XYZ, right? Another fact that people should know is menopause tends to follow your age. Your age at onset tends to follow the age at onset for your mom, right? So your mother. So there's some sort of genetic linkage here. If your mother went into menopause early, it is highly likely that you will also go into menopause early. So talk to your mother. Find out about your family history where menopause is concerned, right? You will both get support as well as information so that you can see the signals, catch the signals earlier. And finally, I think the last thing I would say in terms of emotionally is that one thing we don't give ourselves enough of as women is grace. Menopause is a transition, as you said. It can be a long transition given the different phases. If you start perimenopause in mid-30s, and you don't hit menopause until in your 40s, we're talking about a decade of symptoms in and out, right? Of feeling not quite yourself, of not being who you were in your 30s, in your other 30s, the other part of your 30s, the early 30s and the 20s, right? And that can be uncomfortable and it can be frustrating. So give yourself some grace as you're managing the transition.
Yes. And you spoke about something that we as women don't normally give ourselves, and it's grace, which leads me to our next question about how can women protect their emotional well-being in a world that often demands them to be strong for everyone else first.
Well, I tell you, being a woman is amazing. It's also hard. A lot. It's also hard. It's amazing and it is hard at the same time. I want to preface this response by saying that I am not a life coach, nor am I a mental health specialist, right? I'm a sexual and reproductive health specialist. That said, I am a woman, so I am a specialist on myself, if nothing else, right? Not on all women, but on myself. And with age comes wisdom, as you say. You're not so young anymore. I'm not so young anymore. And so I will say that what I have found, this is from me personally, is that there's a lot of power in the ability to say no. And there's a lot of power in the ability to delegate. Sometimes when we take on everything, we enable a kind of helplessness in the people who are around us, right? So why would they try? Why would Mary, Susan, or Antoinette do anything, right? Why would they do it when you can do it, when you will do it, when you will offer to do it, when your patients or your your belief that you have to do it will lead you to take it up without even giving them a chance to do it, right? So I really want to say no and suggest or recommend others take on a task so that it can give you a little bit of breathing space. And that includes helping them to make decisions. Sometimes people come to us who don't realize that there's mental burden that we carry too. So Michaela, as an example, might come to me and, as her auntie and say, Auntie, I want to know how to do this. Auntie, what you think about this? Auntie, what you think? That's a lot of mental burden that you're carrying because no, you are helping Michaela. You are doing the work of Michaela, right? To think through, to use the information she has, because you now have to play detective and go, well, Michaela, you ask me what I think about your class then. All right, what time the class start? How much class you have? What grade you need to get? Oh, you did the last year. Right? There's a whole lot of information gathering, and that in and of itself is burdensome. That in and of itself is work. So this is why I'm saying, take a moment and reflect it back. Well, Michaela, what you think? Right? Michaela come to me and say, Auntie, what you think about schoolwork? Michaela, what you think? What's important to be think about at this point, right? So that Michaela can in turn do the work. Give yourself some breathing space, because it is only when you do that that you can actually start to protect your emotional well-being a bit more, right? And the other thing I will say that I have learned is that you don't always have to be strong, big S, right? My wish is actually for everybody to be able to find even that one person or a couple core people that will allow you to be strong, small s, right? That means that you can be strong in some parts, some portions of your life, but you can afford to be V, big V, which is vulnerable, big F, which is frail, right? Or fragile. Whatever it is, you can afford to be some other letters in the alphabet with them in other portions of your life. Because other than S, right? You can become other letters in the alphabet in some parts of your life, because you have these people who can allow you to do that. For some of us, we are privileged enough to have a partner that we can rely on. I know some of us, our partner don't allow you to be strong like a S, them require you to be a big strong big S, like a gentleman who that is, because there are people that you can let down your guard with, and that will allow you to create some of that space, some of that breathing room. But real talk, my advice coming from me personally is there's power in the word no. Another person said it this way, which is to say no is a sentence, full stop. You want to come? You can do this thing? No. Do whatever you feel like do with the rest of your time. No, you don't need no explanation. No, you can't do it. No, you don't feel like, oh, that's okay. Right? And reflect back and allow other people to do the work that they are so oftentimes bringing to you, because what you do not realize you're doing when you are big S-ing all over the place, constantly on, constantly a bit strong, is that you are actually enabling a kind of helplessness, and people are stronger than you give them credit for. They are giving it to you to do because you willingly take it on, and they now can sort of relax, kick back, avoid stress because you will take it on. You will take on the work. So that would be my advice.
Let's get into how diet plays a role in balancing hormones and supporting overall women's wellness at every life stage. And alongside diet, what, like the regular routines or the regular habits which help with the overall support of our wellness at all different ages and stages in life.
Well, unfortunately, I cannot speak to the diet and hormones piece of it. That is outside of my expertise. But what I can say in terms of thinking about how we can prioritize our health, right? Even with the schedules that we have, even when life is lifing, let's use that phrase.
Yes.
I really am going to go back to my first answer, which is I talked about creating space, and I want to shift that terminology here to talk about how you can create pockets of space, right? You need to create pockets of space where you can just focus on yourself and your own joy. And let's not shame people. For everybody, it looks very differently. For Michaela, it might look like quiet time. It might look like sitting on the veranda and just staring aimlessly out a door. For hours, for 2 hours. That might be it. For others, it might be reading. For others, it might be 2 hours of watching a show on Netflix, watching your TikTok videos, going to the gym, going for a walk, scheduling a daily talk. Any activity that you can take on that allows you to focus on your well-being, I think is what you really should be focusing on. I think the other thing in terms of daily habits or routines is actually what's coming to mind is these 3 or maybe 4 things. I'm not an expert on aging. I'm not that old yet, but I have heard, particularly for women, that strength training and frequent walks is really good for our physical health, because what we tend to lose as we age is muscles. So what they tell you to do is actually to start doing things instead of doing the cardiovascular and the whatever for tone and for shape your bottom. You really need to be doing lifting weights, right?
Yeah.
So that you actually can bring back in some of that muscle mass that you are naturally using. I also think walking is good, not only because doing a certain number of steps a day helps us to maintain our weight, but also because it gives you an opportunity to start to refresh your brain, right? So if you get out of wherever you are and you leave and you take a walk for 20 minutes, 15 minutes, an hour, you're looking around you, you're doing something that's different. You're not looking at the screen, you're not cooking, you're not doing something that's within your regular routine. It actually refreshes your brain. And the other day I was on a walk with a colleague of mine, and she actually told me that apparently people who pause in the middle of the workday and go for a walk and come back tend to be more efficient with their time after they come back from the walk, right? There's something that is happening with our brains when we actually break and do something else, right? Which is something physical, getting out there, doing something else. The other thing I will say that is something we should be keeping in mind as we age is that our metabolism changes. So I can't speak to diets and hormone imbalances or hormone balancing, but I can say without a shadow of a doubt that our metabolism changes. And for many of us, that looks like dietary changes that we have to incorporate. And that could be dietary changes in terms of what we eat. It could also be dietary changes in terms of how much we eat, Michaela. Many of us as we age, we can't still eat 2-3 cups of rice, for dinner. We can't do that. We can't be eating so many carbohydrates with meat, right, at dinner time. And for God's sake, we cannot be drinking supplement and eating a box food. Those are 2 meals in one. So we really have to change how much we're eating as well as what we are eating as we age. And then I would be remiss if I did not state that the last 2 things that are coming to mind in terms of regular habits. They've been talking a lot. So much research has come out showing the benefits of healthy sleeping habits. If you're not sleeping 7 to 8 hours a night, try and start to get there, because sleep is really, really important to us, and they show a lot of benefits to our brains, to our bodies when we do that. And then the last thing is avoiding stress wherever possible. It is not always possible. There's no such thing as a stress-free life, but there are some situations that we put ourselves in, that we place ourselves in, that bring in added stress, and we don't need to always do that, right? So where you can, avoid taking on more stress than you need to. Avoid putting yourself in a position where you're actually taking on whether that's stressful people, right? And you have some people where just stress you out, or whether that is a stressful situation itself, right? Some of us are in jobs that are really stressful, very difficult. Take the opportunity and try to see if you can move out into a space that is less stressful for you. It's still a work, your money, but doesn't bring you nearly the level of anxiety, nearly the level of frustration, nearly the level of anger, nearly the level of sadness and, emotional turmoil as another job might do. So that's what I would suggest at this point, even though, as I said, I'm no life coach, and not an aging expert, but those are my few thoughts.
Yes, thank you so much for that. And I'm glad you mentioned that the older we get as women, we need to stop doing the cardio and all of that and start lifting weights, because it was a food and nutrition, I think, seminar or conference that I figured out that all women experience or contract osteoporosis, which has something to do with the weakening of the bones. And they encourage us, like, the older we get, to ensure that our intake of vitamin D is increased, vitamin D and calcium.
Calcium, absolutely.
It's increased. So I'm glad you brought that up about the weightlifting, because it's true, the older we get, is the weaker the bones and the muscles get. As I said, I'm not that old as yet, but I am currently facing all the aches that I used to hear my mother complain about.
Yeah, I mean, that too brings some, it's not just familiarity, but resonance, right? And so now, as you get older, you can be a bit more patient and kind to your mother when she is managing these things, because you know understand what it means to manage back pain and leg pain and foot pain
Mhm.
and cramp and all of
Every
these things,
pain and
right?
muscle
Every pain and
contract.
muscle. I know that certainly happened to me. One thing I will say is, I often think about when I think about what we should be doing when we're aging, I really think about the older generation and the fact that during my grandmother and grandfather time, I mean, they lived to be in their 90s. And I think a lot of that is due to the fact that my grandfather and grandmother were active right up until the end, walking miles and miles, still in the fields. My grandfather was still planting yam up until 92, I believe. So I think a lot of what really brings longevity in life is that consistency of exercise. I have a friend here who is in his 80s, and that man is still walking 2-3 miles to the store and back. And I think, as much as, and I'm not saying he is spruce, I'm not saying he is sprite, I'm not saying he's not in pain, but I think he would be in a far worse condition if he was not doing that, walking these 3 miles
Yeah.
almost on a daily basis. And I think it's something about it keeps the body and the mind active, and I think really helps to improve longevity. So as much as we can work in some of those routines, despite how sedentary our lives have become, like you ask anybody, I'm sure if I ask people in your generation, Michaela, so one of the fun, so much of it would be sedentary. Well, I watch Netflix. Well, I'm up on YouTube. Well, I'm up on, right? So much of it is sedentary these days, versus in the older generation where what they were doing for fun is going dancing. And when they Nana dance, they were in the fields for many hours in the day, or on their feet, or active in some other way, right? So when they're
Yeah.
eating all of that food and doing and burning all of those calories, that's a very different kind of process, a very different kind of metabolism, a very different sort of health process that is happening than what is happening now. Right? We are eating a big wok and then we turn on and sit down in front of the TV. We are
And
expending
it's
zero
5.
energy. Yeah, we're
And
expending
then we
zero
blame it on
energy.
niggeritis.
Exactly, expending zero energy, and then we turn around with all of that, and we say things like, "Lord, I'm so tired," right? From many of us, and that is not to throw shade, because I am tired too from doing computer work all day. But it's a
Definitely.
different kind of tired. Mental exhaustion is different than physical exhaustion. Both are exhaustion, but the body processes it very differently.
This brings me to my final question, which is, why is it important to view women's health through a holistic lens, addressing the body, the mind, and the emotions together, instead of just treating each in isolation? So you're focusing on physical health, then you decided, okay, let me work on my mental health. Let's just narrow it down. What's one thing we can do to compile both body, mind, and emotion through a holistic lens and address all three?
I think before I answer that, let me just speak more about what it means to be a public health expert, right? So as a public health expert, my job, my purpose, quite frankly, is to support good well-being. And this means that you can't just focus on the individual. You have to focus on sort of the layers, right? Because there are so many layers that are operating on an individual. So if we think about the socio-ecological model as an example, or a socio-ecological theory, it says that there's the individual, there's the interpersonal, right? Like level, there's a community level, and then there's a level of the society. And at all points in time, there are factors that are working across levels and factors that are working within each of these circles to really impact on health, impact on behavior, impact on all of these things. So as a public health person, I can't, if we go back to this example of walking, right? I can't recommend to somebody to walk every morning to boost their cardiovascular health without thinking about the fact that, well, how that going to work if Michaela has no sidewalks in her neighborhood? How is that going to work if Michaela is afraid for her safety when she's walking? How is that going to work if Michaela doesn't have the right accessories, whether that is the right shoes, whether that is a cane, whether that is arch supports? How is that going to work if Michaela doesn't have the right environment, meaning people around her to see, this is the interpersonal piece, right? To see, Michaela, you can do it. Yes, man, we're going to support you. In fact, we're not gonna turn off the alarm clock when you set it, right? Like, how does that work? So as a public health person, as a public health expert, my background, my leaning, my tenets, my principles, right? My belief system is really that you cannot treat one part of an issue without paying attention to the others, right? Because if you do, what you end up with is either net partial or net zero, but you don't end up with net 100. And so in the same way, if we focus in on changes just at the individual level without, like thinking about just the physical, but not thinking about the mental, thinking about just the mental, but not thinking about the emotional, we will never ever net 100. We will always be netting partial, which is somewhere right in there, probably never even getting to 80%, but somewhere in the 0 to 50, 0 to 30, right, percent, or we're netting zero, right? Point per, so whatever it is, right? So we look at, I will give you an example, right? So sexual and reproductive health is my background. That is where I spend most of my time thinking. Right?
Yeah.
And so for folks who are diagnosed with HIV as an example, right? I can't just focus on the physical, which is about whether they will use the ART, right? Which is the therapy that they are given. But I have to also focus on, well, what does it mean if you are 21 and diagnosed with HIV? You still have a lot of life to live. So I have to also focus on the emotional pieces. What are other ways in which you can protect yourself while still being sexually active? Because you are 21, your life don't done like that. Your curiosity and your desires and your all of those things don't end just like that. So we have to also treat the mental and emotional pieces. Mental pieces might be having to treat the stigma, the internal shame and the external shame that might come with an HIV diagnosis and having to get treatment oftentimes in places that, particularly if you're in a small community, many people might know, well, anybody who got this usually HIV treatment they might get, right? Because it's a small community. You have to manage the mental piece of that to ensure adherence to the treatment, because some people stigma causes them to not continue getting treatment, right? I don't want people seeing me. I don't want people saying anything. I don't want people to still, wonder about what my situation is. So we have to treat the stigma pieces. We have to treat the physical pieces, which is the treatment, and the emotional pieces, which is how do you continue to live and to thrive in a way that is safe as somebody, yes, who is HIV positive, but still has a whole lot of life to live, right? And still has desires for partnerships, for sexual engagement, all of those things. So that is my example of how we actually get ourselves to a net 100, right? By looking at all the pieces rather than just thinking about treating quite frankly, it's not even a treat, it's a band-aid, right? Like when we only look at the physical piece, what we're doing is band-aiding.
Just something to cover it.
Exactly. So back to your pin, let's unpin. What was the thought?
Yes, unpin. So the new medication, which they call PrEP, which is what I see them saying, it's a medication for persons who are HIV negative.
Yes.
And they made it very clear that it's not for any other STI. It's just for HIV. And the person who is HIV negative takes this tablet daily. And they remain, or they'll be able to have sexual intercourse with somebody who is positive. And the virus is not contracted. So what is your 2 cents on this drug?
I am in support of PrEP. PrEP is a highly effective way to prevent HIV infection. And I think it, in some ways, I shouldn't say it came about because of this, but it really has been marketed in many ways to a lot of women, since we have been speaking about women who found themselves in situations where their partners were not open, transparent, that is the better word, about the other partnerships that they had, right? So some people in lay terms will say, well, it's really been advertised to women because so many of their partners were on the down low, so to speak, right? And where they thought they were in monogamous heterosexual relationships, it turned out that they were actually not in monogamous relationships and that their partners may have been having sex with men, right? So men having sex with men. So it has been marketed very aggressively to women as a way to protect them, because there is a lack of transparency in relationships. And so I am for anything that allows people to have an extra protection, so to speak, because HIV is no joke. As much as we have gotten a handle on it, I think most people would rather not, contract a sexually transmitted infection. And so anything that we can put in place to help protect them against that, I am here for it. And we still have an issue, to be honest. I just want to put in the space that prevalence in terms of HIV has not gone away. I know a lot of people think it's gone. It's still around. And in fact, it's highly prevalent, meaning it's much more common among young people as well as among women. Those are the spaces and the places and the people that are most vulnerable right now to HIV. And if it's just a pill that you can pop that is not so, right? You're not doing an injection, everybody take vitamins, right? Like anything that can actually protect you in the space, and I think that is quite fine. What we are seeing, at least in one of the studies that I conducted, we had at least 1 or 2 women who talked about providers being a little bit hesitant to give it to them. So I think that is where maybe there's some work that we need to do to understand what is happening on the provider side, right? Because if an individual is asking for PrEP because they are worried, they're concerned about the partner, they don't feel secure, right, in the partnership that they're in, then I think we really need to be pushing and asking providers what the providers, meaning physicians, doctors, nurses, right? Like, what is the concern about giving somebody PrEP if they've asked for it? I will also say something that came to mind is that I have done research for many years now, and I will tell you, yes, there are many of us women who are strong and independent, and when I take back the chat and we don't feel like nobody can stand up to we and rate it and we stand up for ourselves in our relationships. But there are also many of us who are in relationships and we do not have any negotiating power. And many of us, even the one way out of street, will tell you, when they're in the friend group, them tell us that them not take back the chat and them ray. When they're in the relationship, when they're in the house, when they're in the room, they're the same ones that don't have any negotiating power. What do I mean by negotiating power? What I mean is they are not empowered enough to say, so John, we need you to take a test so that 2 away, we need to take a test every year so that two of us know whether we are, fine, yes or no, right? Don't mean so me not trust you. It's just a way to safeguard and know that we are both safe, we're both clean. Or, John, I need you to wear a condom, and I'm not trust you, but I would like to be safe from pregnancy and from STIs. Or, right. I mean, many of us just don't have that negotiating power, even though we might talk a big talk out the street, because we get into this relationship and so many other dynamics play out in relationships. This is not throwing shade and this is not calling anybody weak. There are just a lot of dynamics that play out in relationships related to, it could be Michaela is like, lad, I couldn't find nobody for a long time. I finally find somebody when I want to mess it up. And you feel like messing it up might happen if you push for something that you think might make the other person uncomfortable. That has nothing to do with you not being strong enough. It has everything to do with other dynamics that might be in the space. So just to put it out there that here is another way, just like how in many ways the birth control pill was made, it was designed to put power back into the hands of women who wanted to be able to protect themselves. In the same way, I think PrEP has been designed to give back power to individuals so that you can protect yourself against this.
Thank you so much for your time, and we really did enjoy this conversation, and I'm sure that it was rather insightful for our listeners and our viewers, because it was very insightful for me myself. I saw Dr. Thompson mentioned menopause and the different things that we go through, the different stages of menopause. She talked about menstruation and how we should refrain from being so conscious. That's a natural thing, just as menopause. We spoke on how sex education should be something which persons have access to proper, not just the brush on the top. We're talking getting in depth. And we also spoke on PrEP, which was my little bonus question for the evening. Thank you so much again, Dr. Thompson. You have a wonderful day, and thank you so much to our viewers and listeners.
Bye.
And that brings us to the end of this episode of the Beyond Woman podcast. I hope you're leaving feeling inspired and ready to take action. Remember, you are capable of so much more than you think. Keep pushing those boundaries, keep learning, and keep believing in your limitless potential. We want to stay connected with you, so be sure to follow us on social media at The Beyond Woman Magazine for daily inspiration and behind-the-scenes content, and to join our growing community of empowered women. Visit us at www.thebeyondwomanmag.com and www.thebeyondwoman.com, where you will find more resources and articles to support you in your journey. Sign up for our newsletters and be the first to know about our exclusive events and for more opportunities to connect. To all my Caribbean sisters, let's lift each other up. Share this episode with the women in your life who need to hear this message, and let's continue to build this powerful network together. If you enjoyed this episode, please consider leaving us a review on this app. Your support helps us to reach more women. Thank you for being part of the Beyond Woman movement. Keep shining, keep growing, and keep living your extraordinary life.